Hello viewers, welcome to AAU Talks. My name is Samonya Konjapon, and today we are going to discuss a very interesting topic, breastfeeding. Poverty is always similar in many developing countries. However, one example of poverty that is common among all other developing countries is malnutrition, which is basically caused by the lack of breastfeeding among mothers. We will take a break, and then when we are back, I'll introduce my guest in the studio to you.
My name is Dr. Violet Makuku, a quality assurance expert with the Association of African Universities. The Association of African Universities is here with the African Quality Rating Mechanism, internal institutional evaluation tool that can help you improve the quality of higher education, whether it is in teaching and learning, in ICT, in infrastructure, financial management, university management, and all the other aspects whose quality should be monitored in the university. Kindly follow the provided links for you to understand more about the African Quality Rating Mechanism, institutional evaluation process, and also to get hold of the form that you can use to express interest. AAU, the voice of higher education in Africa.
Welcome back, viewers. So let me go straight to our panelists for today's discussion. Welcome, Professor Inti.
Welcome, and how are you today?
I'm very good. I'm doing great. I want you to introduce yourself and your institution that you are working with.
Okay, I am Alice Inte, a professor of pediatrics and child health, working at the University of Port Harcourt Teaching Hospital, the University of Port Harcourt in Nigeria. Okay. I am the coordinator of the Baby Friendly Hospital Initiative of the University of Port Harcourt Teaching Hospital, Nigeria.
Yes. So viewers, like I mentioned, we are discussing the topic breastfeeding, and this week is Breastfeeding Week 2018, and we have Professor Inti, who is going to do justice to the topic and tell us the importance of breastfeeding as a mother. Thank you. Prof, why is breastfeeding important?
Well, studies have shown, and if you start from the Bible, it teaches us that we should give children breast milk. It says, desire the sincere milk of the word that you may grow thereby. So to support this position of the Bible, worldwide has been shown that when children breastfeed, their nutrition is optimal. They are more likely to survive, they are better in their nutritional status, and they grow better. And how do we want the children to be breastfed? We want them to be given breast milk and nothing else within the first 1 hour of birth, and you continue with what you call exclusive breastfeeding, giving the children no other food or drink unless it is medically indicated for the first 6 months of life. Thereafter, you give the baby breast milk and other foods until the child is aged at least 24 months. That is what we call optimal breastfeeding practice, and it has a lot of importance for the children. It improves their growth, development, and survival. It reduces their risk of death from diarrheal diseases, malnutrition, different types of infection, and stimulates their intellectual growth.
Wow, Prof.
So
Prof, you made mention of exclusive breastfeeding. Can you explain that to us?
Yes, exclusive breastfeeding is a practice of giving a baby in the first 6 months of life no other food or drink except breast milk. Now, we said except it is medically indicated. For example, if a child has pneumonia, you want to give antibiotics, you can give the child. Yes. If a child needs oral polio vaccine, you can give. That does not preclude the fact that the child is being exclusively breastfed. So we don't want the child to be giving water. In fact, in the African region, water is a very important thing. 98% or more of mothers in our region start breastfeeding the children, but because they give water and other homemade remedies, they reduce the exclusiveness of the breastfeeding. And globally, it's been shown that just about 45% of babies are exclusively, less than 40% are exclusively breastfed, and about 45% continue to breastfeed till at least 24 months of age, as has been agreed at the World Health Assembly.
So Prof, you were giving statistics on breastfeeding. Let's come down to Africa. What is the statistics when it comes to breastfeeding in Africa?
Yes, most mothers in Africa breastfeed, at least over 90%. In fact, in Nigeria, up to 98% of mothers start breastfeeding a child within 24 hours or so of the life of the baby. But the challenge we have, for example, in Nigeria, the exclusive breastfeeding rate is less than 25%. Why? Because the mothers start the breastfeeding and give water or other foods, and those other things you give to the children increase the risk of the children having diarrheal disease, other infections, and reduce the likelihood of the child succeeding in breastfeeding.
We will come to the negative effects of breastfeeding. However, I want to know what is the reason why women don't exclusively breastfeed, like you said, in Nigeria?
It is not peculiar to Nigeria. Even in Ghana, it is also a problem. It's a worldwide problem.
Yeah, so I was basing it on your example that you gave, not saying that it's not prevalent in Ghana, but let's focus on Nigeria.
The reason why it is not being done is purely because the mothers don't have adequate information. Some of them are not given the right information from antenatal period. Some of them do not understand that it is doable. And in Africa, you know, it's a cultural thing that the child who eats must drink water. Yes. But you see, in breast milk, at least 80% of the content is water. So for the first 6 months, the breast milk produces sufficient water to meet all the water and food to meet the nutritional needs of the child. So it is to reorientate our mothers that culturally or in whatever form, we don't need to give the child breast milk.
So what is you
don't need to give the child water in the first 6 months of life.
Okay, so what is your institution doing when it comes to educating mothers on breastfeeding?
Oh yes, part of what we have been doing is seeking for ways of promoting, protecting, and supporting breastfeeding. And that's why we keyed into the global celebration of the World Breastfeeding Week, which is done between the 1st and 7th of August every year. We've done it for over 25 years. So globally, we join in that celebration to enlighten mothers, to inform them, and galvanize action that will promote, protect, and support breastfeeding. And today, part of why we are talking about it in the AAU talks is because part of the actions we should do is to integrate talks on breastfeeding, training on breastfeeding into the undergraduate curricula of university students, so that...
Please, we will come to that section, but then I want us to tackle the issue of breastfeeding in Africa or developing countries. You could see that the trend of malnutrition is increasing. For I think in the Demographic and Health Survey, Ghana has been having a fluctuating trend of malnutrition, and similar thing can be said about Nigeria. What is causing these trends?
Well, you know that globally people are suffering from recession, and many mothers are now having to work, so they believe that they cannot effectively combine their reproductive and the productive lives. So they don't know that they could go to work with their babies and breastfeed the babies, and the work environment may not be that supportive. Maybe here I didn't see a crèche, but I can see many young ladies working in this AAU secretariat. So
what do you propose? Should the workplaces have a place to feed children?
Correct. We're supposed to support breastfeeding. The International Labour Organization recognizes that as a right of every woman, that when she is breastfeeding, she's entitled to paid maternity leave depending on the situation in the country, but should be long enough to allow her at least, it's in some countries up to 6 months. In Nigeria, it is 4 months paid maternity leave. So during that period, she is encouraged and supported to breastfeed the child. Thereafter, she returns to work. Up to 6 months after, she is allowed to have a 1-hour breastfeeding break. It's a global policy.
But wouldn't it affect or distort workplace practices or work flow?
Well, that is a very interesting thing, you know. The first thing we must know is that breastfeeding the child is a right of the woman, because the woman herself benefits from the practice of breastfeeding. It protects her own health and the health of the child.
6 months,
yes.
And then you come back to work.
And you are still asking for more time to breastfeed. Yes.
Yeah, so,
because the child needs to be breastfed for at least 24 months. And then in the first 1 year of life, the child's risk of death is much higher. So during that period, the mother is supposed to have a lot more support to breastfeed the child. And you know, when a mother breastfeeds optimally, as we've talked about, she is more productive at work.
Yes.
Let me explain it further.
I'll be interested.
The first thing is that when the mother breastfeeds that way, her child's risk of morbidity, sicknesses is reduced.
Yes.
So the mother works better. Now, if you make available a breastfeeding room in a place, because the point is that wherever you employ at least 10 women of childbearing age, you should have a room designated for supporting breastfeeding.
Is it possible in Africa, or is it being implemented in some places in Africa?
It is Africa that really needs it more. In my hospital, we have a crèche. So when you come to work, you come with your baby to work. And as you stay in the office, the baby is there playing with your caregiver in the place while the mother is working. So each time she feels she has to breastfeed, maybe usually within 2 to 3 hours, her breasts are feeling full, or her baby needs, she goes and breastfeeds the baby and comes back to work. That way she can stay longer in the office and contribute more effectively, because her mind is focused. She knows her baby is there. She doesn't have to be wondering what is happening to her baby at home. Additionally, the baby falls ill less often, is stronger, and the breastfed baby, even if he's ill, he survives better, because some protective agents in the breast milk called immunoglobulins and the macrophages, some fighting cells, pass through the breast milk to the baby. So when
can you repeat those?
They call them immunoglobulins.
Immunoglobulins.
Yes, you know, when a mother has, for example, common cold, there are viruses that cause it. So her body will produce what we call antibodies, in form of immunoglobulins, that will fight the infection and protect the mother and help her to recover.
And all in the breast milk?
In the mother. So when the baby mother is breastfeeding, some of those cells move to the breast and produce those immunoglobulins in the breast, and it passes through the breast milk to the baby. So the baby is protected, while very important, not only and many breast milk to living. It cells that fight infections, globulins. Then breast milk mother is not the infant formula, made one Lactalis infant, that it was contaminated from the source. And
so
many babies.
A lot of importance of breastfeeding. Is breastfeeding only important for the child?
Oh, well, no, not only. The breastfeeding is important for the baby. We've talked about the baby. For the mother, it protects the mother against cancer of the breast, cancer of the ovaries, and other forms of non-communicable diseases. And it said that when that failure to breastfeed contributes to the death of 823,000 years. And then for the mother, solely on the mother's health, talked about, it protects her nutrition, and it's common in women. Protects a mother against postpartum hemorrhage. You know, when she's breastfeeding, hemorrhage, that is bleeding after delivery. Do not, when a baby is born, baby is supposed to be put on. When the baby hormones, the hormone is released, it causes the uterus to contract.
Interesting. And
with that contraction, the risk of placenta retention, and it also makes the uterus to closes up the big blood vessel. Though it long as she's doing exclusive when lactation also help with breastfeeding.
So, please, what's the progesterone? You are giving us a lot of
it has produced in the brain that help to stimulate breast milk production. The progesterones help the oxytocin make the milk to flow out. So the two hormones are important, and their production is affected by stress, anxiety, negative thoughts, pain, and so on. So when we help the mother to breastfeed, that progesterone is high, bringing out eggs. What you may not get pregnant, prevented. And when a mother is not or becoming anemic, then it also helps the mother bond with the baby. the mother-child bonding is a close relationship that helps the mother in psychological stresses and so on. The mother feels more relaxed and rests better if she's breastfeeding the baby. The other aspect is that the intelligence quotient of the child is better. A breastfed child up to 15 years of age still has some points higher in the intelligence quotient performance than a child who is not breastfed. So for the mother, she will save a lot of cost. The child will do better in the academics, will fall ill less often. She does not also need time to prepare infant formula. She doesn't need water. Breastfeeding has all the water we need, but infant formula, you need a lot of water, a lot of time and money and energy to prepare them.
Yes.
Then you also generate a lot of waste, which contributes to the environmental degradation we're talking about. So when a mother breastfeeds, the family is protected.
You've mentioned something, the environmental degradation.
Yes.
Yes, can you hit on it again?
Yeah, when you are making infant formula, you need a lot of water, you need a lot of energy, the carbon footprint. So all these are contributed to by a mother not breastfeeding when she's using infant formula. Then the cans, the packages, you need to dispose of them.
Yes.
Some constitute nuisances by becoming breeding spaces for mosquitoes in the environment.
Okay.
So we need to help the mothers.
Sure.
Then you talk of the money to buy the formula, money to buy water, money to buy the utensils, to clean the utensils, to prepare the meals, boil it. All will be saved. So breastfeeding says for every $1 you invest in helping a mother to breastfeed, you save $35 in return.
Wow.
So it is a cost-effective way, and that not breastfeeding is costing the world about $302 billion every year because of all these expenses we are engaged in.
Sure. All right. Thank you very much, Prof. Hello, viewers. It's been an interesting discussion already, and then Professor Alice Inti has touched on several importance of breastfeeding, which I think we should pay much attention to. We'll go for a break, and when we are back, we are going deep into the week celebration of breastfeeding 2018.
Hello everyone, I'm Georgina Mason from the Association of African Universities, here to invite you to the Coding Skills for Everyone workshop. The workshop aims at introducing participants to the world of computing and programming. Registration for the workshop is 100 Ghana cedi. For more information, visit blog.aau.org or send me an email on gdmason@aau.org.
Welcome back again. We are discussing breastfeeding, and we have touched on the importance of breastfeeding. Now we are going to delve into the Breastfeeding Week celebration 2018, and in our studio today is Professor Inti from Prof from Port Harcourt University. Yes, from Port Harcourt University. She's going to do justice to the topic that we are discussing today. Prof, now let's talk about the Breastfeeding Week once you've touched on the importance.
Okay. So this World Breastfeeding Week has been celebrated globally for over 25 years now. And each year we choose a theme that brings out the real importance of breastfeeding. This year's theme is called Breastfeeding, the Foundation of Breastfeeding, Foundation of Life.
Foundation of Life.
Yes.
So and if you say breastfeeding,
Foundation of Life.
Wow, I like that thing.
Yes, because it says that breastfeeding is a universal solution that levels the playing field, giving everyone a fair start in life. It improves health, well-being, and survival of women and children around the world. So in the first 6 months, when mothers breastfeed their children, every child has an equal chance to survive, to grow intellectually, to fight infections, and to optimize their potentials. So it is a foundation. And this year we're supposed to have, the objectives are very clear. We want to inform mothers, inform parents, inform everybody about the beautiful links between good nutrition, security, poverty reduction, and breastfeeding. You see, we were talking about
how does this link up?
Yes.
Good nutrition, poverty, and
reduction, security. Yes. You see, breastfeeding, I have talked to you about the benefits of breastfeeding. So breastfeeding on its own provides adequate nutrition for the child.
That's one.
In the first 24 months of life, and you continue the breastfeeding till the child is at least 36 months of life. So that is the nutritional needs of the child. Now we've talked about poverty.
Yes.
Now when a mother is breastfeeding, all those costs, including the cost of treating the child, is taken away. But beyond that, that is the short term. On the long term, the child's life is improved. Morbidity from diseases like diabetes, lymphomas, asthma, all those communicable diseases, non-communicable diseases, I've talked about malaria, measles, pneumonia, and the non-communicable diseases like asthma, diabetes, hypertension, obesity. When a mother breastfeeds her child, the child is protected against these other diseases. So in the short run and on the long-term basis, breastfeeding contributes to the economic growth of the child. Now we talked about reducing poverty too, when the mother spends less money on breastfeeding. Then we talk of security. The United Nations defines food security as people having access all the time to the food they have, whenever, wherever, and however they need it. So when a mother is breastfed, you know, we say food is ready. That is the mother going with the baby. A mother breastfeeds her baby. The breast milk is available 24 hours a day, all the time, in any form, any way the baby wants. And the food the baby is receiving is best, even in times of crisis. People say, oh, when there is crisis. Yes, it's even when there is serious crisis with malnutrition, displaced people, breastfeeding provides the best umbrella for the baby, because it provides both the food and the protection the baby needs. So for the mother, we talk about breastfeeding as the foundation of life. For the child, we've talked about the intellectual stimulation, the bonding, and all the other benefits. So when you give the child that foundation, you increase the likelihood of the child surviving and growing very well. So we want to engage people at different levels to make sure they promote, protect, and support optimal infant and young child feeding practices, which starts with breastfeeding.
Okay. So, Prof, you've made mention of a lot of importance. However, this importance of breastfeeding were talked about for children and mothers. And then in our current world that we are in, and let's say sub-Saharan Africa, a lot of fathers also breastfeed. And are there some importance for fathers who breastfeed?
The fathers are taking the children's food. They should leave the child to take his food.
But they also want the benefits of breastfeeding.
No, these benefits we've talked about is for the child. We talk about the immunological benefits. You know, the child's immune system has not developed. So when the child takes breast milk, it helps the immune system to grow. The father does not need it. The child's brain needs to grow. The father's brain is already grown. The child needs food in the first 6 months, which is breast milk alone. And with other foods till at 24 months to 36 months, the father can eat many other foods. Interestingly, by the time the child is 6 months of age, we want the child to have what's called complementary food. That is, all other foods in the house, you can make them in the form that the child can take. You talked about pap. I can see in Ghana you have a lot of foods. So you prepare them with fish, mash it with yam, beans. You cook very beautiful food. So if we mash all these ones into simple forms that the child can take, the child doesn't need already prepared follow-up foods like cereals and follow-on milk. The child doesn't need it. It is these household foods we want fathers to help the women to make them available for the children. So the father, some of them complain that when the child is breastfeeding, it impacts on their relationship with their wives. It doesn't. You know, if you see the logo for the World Breast, you see the baby, the mother, and the father at the back giving support. The man can relate with his wife sexually and in all other forms. The baby and the father can sleep on the same bed with the mother while the mother breastfeeds, so that the family unit is not disrupted. And people used to be afraid in my country that when a man relates to his wife sexually, that the semen will cause ear infection. It has no relationship at all.
On the child?
Yes.
While the child is in the...
No, the child that is breastfeeding. So because of that, men don't want to sleep with their wives. No, it has nothing to do with ear infection. Yes. So the child is fine, the father is fine. So
I can't even wrap my head around it.
It's a myth. It's a myth.
Yes.
Yeah, it doesn't work.
It has to be a myth. It has to be a myth. Okay, so Prof, how can celebrating this breastfeeding week help to improve child survival? Just some few, you've touched on a lot. We
want everybody to know. So as you continue to celebrate it, many more people will get to know about it. For example, today now you've provided the audience for us to talk about the people out there watching this station. Yes. So that we know that breastfeeding is the good thing to do for the baby, and that every mother can breastfeed. If a mother has a reason to feel she cannot, she has to be assessed and supported. Many people are not breastfeeding because they don't have the skill to do it, and the skill can be taught to the mothers.
But what of the situation whereby a mother can't breastfeed because it's not producing milk?
Oh, that is a very simple thing. Just look at a tap that has not been opened for some time. The tap is dry, but when you open it and there is water up there, water will flow. So for the breast milk is not, it does not waste. So when the child starts sucking, initially the brain will say, does the child want it? Yes. It will release, I told you about the two chemicals, progestogens and estrogens. They will be released as the child suckles the breast, as the mother touches her child and sees her child and knows she has to breastfeed. And we give her supporting environment. The milk, the hormones will be released, and the milk stimulation will go on. So, and you know, in the first few hours of life, it is very small quantity, which we call colostrum, the yellow milk. So some mothers say, oh, the milk is not coming in. No, put the child on the breast. That little quantity that comes out is what the child needs. And because it goes directly from the breast into the mouth of the baby, you may not even see it. So you think nothing is coming out. So want to discourage people from giving babies anything at all in the first 6 months of life.
Prof, what about the effect in a situation whereby the mother is having a sexually transmitted disease like HIV? And then how does a mother breastfeed in such a situation? Well,
the mother with HIV has gone through a lot of experiences. No, initially they were saying breastfeed, it is fine. They say, oh, don't breastfeed, oh, this. We've gone through all that. But studies have shown now that when a mother is taking her medications, a highly active antiretroviral treatment, and she has antenatal care, usually the viral load will come down. And the mother, she delivers in a hospital where she receives care. They will give her the nevirapine. She continues with antiretroviral medications. She will breastfeed the baby exclusively, just like every other mother.
Without transmitting?
Yes, for the first 6 months of life. Then continues with breast milk and the other food till 12 months and stops. Now we're talking of elimination of mother-to-child transmission of HIV infection. And this way we have recommended for breastfeeding, and the continued breastfeeding has been found to prevent HIV transmission.
Okay, Prof. So viewers, it's been an interesting discussion with Professor Inti. We've talked about the 2018 World Breastfeeding Week, and then Prof has even talked about how to handle situations whereby mothers are having HIV and how they can breastfeed their children. We are going for a break, and when we are back, we are going to talk about what institutions can do to support breastfeeding in Africa.
Hello everyone, I'm Georgina Mason from the Association of African Universities, here to invite you to the Coding Skills for Everyone workshop. The workshop aims at introducing participants to the world of computing and programming. Registration for the workshop is 100 Ghana cedi. For more information, visit blog.aau.org or send me an email on gdmason@aau.org.
So we are back. We are going to wrap up the show, and before we do that, we want Prof to tell us about what institutions like AAU can do to support breastfeeding in Africa.
To support breastfeeding in Africa, the AAU must show the example.
Yes.
For example, in the secretariat here, we want to see promotion, protection, and support of breastfeeding by supporting the young ladies here. The universities have to integrate breastfeeding teaching and optimal infant and young child feeding into the curriculum of teaching to students. For example, at the undergraduate levels, the general studies.
So we put in a curriculum.
Yes, then the undergraduates, they are the parents of tomorrow. So they need to be made to know about breastfeeding and how they can feed the future generation of parents. Then the students who are already parents need to be supported. They need to have a breastfeeding friendly environment. For example, you go to some classrooms, you see that mothers are there with their children. There's nowhere to keep the child, and so once they start school, they drop the child at home. They're not breastfeeding. So when we become baby friendly in our facilities, schools, we can provide a place where students, especially the older, mature students, graduate students who already have babies, where they can keep their babies and breastfeed. Then the workers in the environment, the workers in the universities and other institutions need to be supported to breastfeed their babies by actualizing the rights of the mothers to breastfeed, providing breastfeeding room, breastfeeding friendly work schedule for the mother that is breastfeeding, allowing her paid maternity leave, allowing her to come to work with her babies, give her breastfeeding breaks so that the children will be supported and made to be healthy. So that is how the AAU can help us promote, protect, and support breastfeeding. Yeah,
so we have captured your response, and then we are going to work exactly on that.
Thank you very much.
But Prof, before we wrap up, we want to have your final remarks on Breastfeeding Week 2018.
Well, Breastfeeding Week 2018 has told us that breastfeeding is the foundation of life, and to ensure that every child has equal rights and opportunity, want to say that mothers everywhere should initiate breastfeeding within 1 hour of birth of the child, continue with breastfeeding alone till the first 6 months of life, and thereafter breast milk with other foods should be given ideally for 36 months. That is a period of complementary food. We want to discourage the use of infant formula, feeding bottles, sprouted cups, and that countries should comply by the International Code of Marketing of Breast Milk Substitutes by promoting breastfeeding against the unethical marketing practices of infant food manufacturers. It will help us. Thank you very much.
Thank you very much, Prof, for also joining us. So viewers, it's been an interesting discussion with Professor Inti, and we have touched on the importance of breastfeeding, and she also encouraged fathers and other institutions to support women who are currently breastfeeding. Thank you for staying tuned. Bye-bye.